It's often difficult to localize pain in babies, but sometimes you can see the way the child is behaving. Child with a tummy pain, for example, might draw up the leg and
Draw up as in raise their legs
raise
up.
the leg or go into a fetal position.
Okay.
That might alleviate any pain in tummy. Sometimes a child might have a distended abdomen in relation to crying. If the child is crying and got distended tummy, it might be because of colic, maybe because of any other obstruction or even constipation. A child might be scratching or touching the area, especially in a slightly older child, child who's about 3 months of age or something like that. They might be able to hold, they might be touching the tummy. The younger child is harder to identify these things, but drawing up the leg is a telltale sign of a tummy pain. Otherwise, it's if the child is crying constantly, just look at the tummy, looking at how distended tummy is, or to look for hernias, because hernias can also cause pain.
Yeah.
So looking for lumps in the groin, and also looking at the testes. So it's important to open up the nappy and look for the testes. Sometimes the testes can be twisted, sometimes the testes can have inflammation. These are all very rare in a newborn baby, but it's important to check. So the tummy doesn't only extend from the chest down to the pelvis, but also down to the groin.
Right.
So to look for all these areas, just in case there's something going on with your boy child. The same thing happens with the girl as well. So if the girl child has got a hernia, you need to have a look at the groin area.
Right.
As well. To be practical as well.
Yeah.
If you look at a child is crying, and maybe child is crying for feed, child is uncomfortable, maybe child has got a bit of wind, and those are things that will pass.
Sure.
So you don't want to rush to your doctor, and then when you present to the doctor, which is often the case, the child is completely fine.
Right.
So what you want to do is maybe wait for a couple of hours to see whether it settles down, and see whether it's maybe wind. Sometimes parents would like to give the child a bit of a massage in tummy, and they might pass some wind, and that's it. Yeah. So a trapped wind is a commonest cause of tummy pain in children, in babies. So a bit of massage, gentle massage, and maybe some anti-colic medications, which most parents will know about. Maybe gripe water, or some colic medicine that you can get from the pharmacy can be useful. But if they don't settle within two hours or so, it's best to take the doctor. If the child is persistently crying for two hours or so, then best to take the child to the doctor, because that means that is a sign of severe tummy pain. There can be various different conditions related to this that the doctor needs to exclude.
Right.
A child who's crying and starting to vomit is quite serious. So a child who's crying and not settling and also vomiting, you don't wait for 2 hours. You think there's something else going on, especially if the vomiting is green in color.
Yeah.
You need to take the child to the hospital or to the GP.
Okay.
Yeah.
Thank you, Doc.